Let's start a medical interview with the patient John, 30-year-old man with lower back pain.
All right, let's get started. I'll take on the role of John, a 30-year-old man experiencing lower back pain. You can begin by asking me questions to gather more information and provide a diagnosis or treatment plan. Patient: John, age 30, chief complaint: lower back pain. You can start the conversation whenever you're ready.
Good afternoon. It's John, isn't it?
Good afternoon, doctor. Yes, I'm John. How are you?
Hi, I'm Dr. Dennison. I'm a student doctor at St. Mariana Hospital. I would like to ask you a few questions today and take a few notes. Is that okay?
Hi, Drive. Dennison. Sure, that's fine with me. What do you need to know?
Could you tell me why you came to the hospital today?
I've been having this persistent lower back pain for the past couple of weeks. It's not getting any better, and sometimes it even gets worse, especially when I'm sitting for too long or trying to lift something. I thought it might be a good idea to get it checked out.
I see. So you have lower back pain, and you said it started a couple of weeks ago. About when did it start?
It started about 2.5 weeks ago. I remember it pretty clearly because it was right after I helped a friend move some heavy furniture.
I see. And so do you think the back pain is connected to moving the heavy furniture?
Yeah, I think it might be. The pain started pretty much the day after we moved the furniture. I was lifting and carrying a lot of heavy stuff, and I didn't really pay attention to my posture or anything.
Since the initial pain, is anything making it worse?
Yes, certain activities seem to make it worse. Sitting for long periods, especially in a chair without good support, really aggravates it. Also, lifting anything heavy or even bending down can make the pain sharper. Sometimes, even standing for too long can make it ache more.
Oh, I'm sorry to hear that. Have you tried anything to relieve the pain?
Yes, I've tried a few things. I've been taking over-the-counter pain relievers like ibuprofen, and they help a little bit. I've also been using a heating pad on my lower back, which seems to provide some temporary relief. I tried resting and avoiding heavy lifting, but the pain is still there.
I'm sorry to hear that. All right, can you describe the pain exactly? Is it throbbing or sharp?
The pain is mostly a dull, constant ache, but sometimes it becomes a sharp, stabbing sensation, especially when I move in a certain way or try to lift something. It can also feel like a burning sensation at times, particularly after sitting for too long.
I see. Can you show me exactly where the pain is?
Sure. The pain is located in my lower back, right around here. John points to the area slightly above his hips, spanning across his lower spine. It sometimes radiates a bit towards my hips, but it's mostly centered in this area.
I see. So the pain is also in your leg or hips?
Yes, occasionally the pain radiates towards my hips, but it doesn't really go down my legs. It's mostly concentrated in my lower back and sometimes spreads a bit to the sides.
I see. On a scale of 1 to 10, 1 being no pain and 10 being the worst pain, how would you rate your pain?
On most days, I'd say the pain is around a 5 or 6. When it gets really bad, like after sitting for a long time or lifting something heavy, it can go up to an 8.
That must be very difficult for you. Have you ever had this kind of pain in the past?
No, I haven't had this kind of pain before. This is the first time I'm experiencing something like this.
Do you have any other medical conditions?
No, I don't have any other medical conditions. I've been pretty healthy overall.
All right, that concludes our questions. It appears that there must be something in your nervous system and your lower back. We would like to see what the issues are. I recommend getting an x-ray. Is that okay?
Yes, that sounds fine. An X-ray seems like a good idea to figure out what's going on. Thanks, Drive. Dennison.
Thank you. Have a good day.